Yes, my friend. Thank you for coming. You are coming from a very long distance.
Yes.
You are coming from Alaska, right?
Yes, sir, that's correct.
How is the weather in Alaska?
It is on the cool side. It's still raining. It was raining all week this week.
It's also cool here.
It is.
Maybe similar weather, right?
I brought it with me.
That's fine. So you are leaving tomorrow?
Yes, sir.
Okay.
In the afternoon.
Summer is coming after you.
Yeah, for you.
Okay, thank you. So you had the varicocele surgery before,
That's correct.
3 or 4 years before you had surgery, right?
Before this surgery here?
Yes.
I had it last July.
Last July, I'm sorry.
Yeah.
So why did you have a surgery for varicocele? What was the reason?
I was told by a Navy corpsman in 1982 that I had varicocele, but it was approximately 3 years ago that the pain started to get intense.
So 3 or 4 years before you had the pain, the pain started.
Yes, sir, that's correct.
How was it? How was the pain?
It was sharp stabbing pain.
Yeah.
Yeah.
And is it so? It was affecting your life, and
it was.
you wanted to get rid of it. Right?
Absolutely. Yeah.
And what was wrong with the procedure? Why
my nephew had the same procedure a few years before me. His pain diminished after 4 months. Mine didn't go away for 9 months until I called you, and then I prior to that I was worried, and I started to do research and found your videos on the internet.
In conventional procedure, normal procedures, there is 70% possibility, which is not very low, high possibility, the operations are successful. But there's a 30% risk, not recurrence, actually it's persistence of the varicocele. Your case is not, the veins are not come back later. They were there and they didn't disappear. It's the risk of normal conventional procedures. It happens everywhere. And so the pain usually diminishes, go away when the veins are disappear. In your nephew's case,
that's right.
It takes 4 months for the veins to disappear, I can guess. Then you decided to come here. Was it difficult to visit? Is there a direct flight?
Well, I flew from Sitka, Alaska to Seattle, and then Seattle direct to Istanbul.
Okay.
So everything was simple, very easy.
Okay, so it's possible to
Absolutely.
do it.
Absolutely.
And when did you arrive?
Last Saturday.
Saturday, and you operated on Monday?
Yes, that's correct.
Now it's Thursday?
Yes.
How do you feel?
I feel well. Yeah, a slight pain or aching in the incision area, but nothing in the testicle area.
Can you tell the previous pain, the pain that you are come here for, is it now present?
No, it is not.
Yeah.
No, just the incision, but that's it.
Normally, it will take 4 or 5 months for the pain to disappear in conventional procedures. In our procedure, it's shorter. Sometimes just immediately during the operation it finishes. Sometimes it takes 1 month for the scar tissues to heal. Now you have the pain of the scar, but it is not important. It will go away anyway. And there's swelling now. In 1 year you have 2 operations in the same site, so there is some edema, some reactions, and it will go away soon. You asked me about sit-ups, right?
Yes, that's correct. I do sit-ups every other day.
Yeah, it's, increasing the abdominal pressure is the most risky part of our recovery. I don't want to make some Valsalva maneuver, some increasing the abdominal pressure for actually as long as possible. For real hard Valsalva, I don't want to do it for 4 months. But for sit-ups, it's not some weightlifting. It's your own body. I want you to not to push so hard. So if you are doing it for a long time, you will get used to it. You will not push yourself too hard. Just try to listen to yourself, your body reactions, and if you are really pushing too hard, delay it a couple of months.
Okay.
But if it is easily going, if you're not increasing the abdominal pressure too much, you can do it at 1 month.
Okay.
But 1 month, do nothing, just rest. Walking is okay.
Very good.
Elbow running is okay. After a again after 1 month.
A quick question. In August, I'll do a 22 kilometer hike. Is that okay?
Doing it. Americans always do such things very too long.
Is that too soon?
22, yeah, actually 22 is too long.
Okay.
But after 1 month, start gradually.
Okay.
First, in Turkey, we walk 22 kilometers in a year.
Okay.
1 year period.
But can I do it in August?
Yeah, August.
Okay.
Yeah, August.
Okay, very good.
August, I think so.
Okay.
So increase it gradually. Start 1 month later.
Very good.
And, yeah, gradually increase.
Yes.
Okay, 22. You walk or run?
It's going to be a hike up Manechkum volcano in Sitka.
So it takes how many hours? Maybe 4 hours.
No, about the whole hike. They allow 10 hours.
Okay, so 10 hours. In 10 hours, it's good. It means it's not like running, like pushing too much.
It's a steady pace.
Well, there's a volcano, right?
Yes.
Okay, so thank you for coming.
Thank you.
Do you have any advice for those who will come from long distance?
I would recommend this procedure over my previous procedure because it seems to worked out a lot better for me.
Yeah.
Yes, I'm very pleased with it.
How is the post-operative early days?
Pain-wise?
Yeah,
It was not.
recovery-wise.
It was not bad. It was tolerable. Yeah, I've had worse pain. I would rate it on a scale of 0 to 10. I would put it at maybe a 4.
Okay, nice. So second procedures are always a little more tricky and more difficult, but we get used to it.
Yes.
Maybe half of our procedures are secondary cases, recurrent cases. Okay, thank you for sharing.
Thank you very much.
Yes, thank you.
Thank you.